Hello learners! Did you know about the scalp? So keep an eye out and learn about. The scalp is composed of soft tissue layers that cover the vault of skull or cranium. Conventionally, the superficial temporal region is studied with the scalp. In this video, we shall look at the anatomy of the scalp. Its extent, structure, blood and nerve supply. Extent of scalp. Anteriorly, it is up to supraorbital margins or eyebrows. Posteriorly, it is up to external occipital protuberance and superior nuchal lines. And on each side, it is up to the superior temporal lines. Structure of scalp. The scalp is made up of 5 layers. From superficial to deep, these are as follows. A. Skin. B. Connective tissue. C. Aponeurosis. D. Loose areolar tissue. E. Pericranium. The sequence can be easily remembered by a perfect mnemonic. Scalp. First, skin. The skin of scalp is thick and hairy except over the forehead. It is adherent to the epicranial aponeurosis through the dense superficial fascia. It has more number of sweat glands and sebaceous glands. Second, connective tissue. The superficial fascia of the scalp is made up of dense fibrous connective tissue. It is more fibrous and dense in the center than periphery. It is firmly binds skin to the underlying occipitofrontalis and its aponeurosis, and provides medium for passage of vessels and nerves to the skin. Third, aponeurosis. This layer is formed by occipitofrontalis muscle and its aponeurosis. The aponeurosis of occipitofrontalis muscle is also called epicranial aponeurosis, or galea aponeurotica. The occipitofrontalis muscle consists of 4 bellies. 2 frontal bellies or frontalis, and 2 occipital bellies or occipitalis. The frontal bellies are longer, wider and partly united in the median plane. Each arises from the skin of the upper eyelid and forehead. The occipital bellies are small and separate. Each arises from the lateral 2/3 of the superior nuchal line. First 3 layers of scalp are called surgical layers of scalp. These are called scalp proper. Fourth, loose areolar tissue. As the name indicates, this layer is made of loose areolar tissue. It serves as a natural plane of cleavage during craniotomy. This layer is traversed by emissary veins which connect extracranial veins to intracranial venous sinuses. Fifth, pericranium. This layer is formed by the periosteum of bones of vault of skull. It is loosely attached to the bones and can be easily stripped, but at sutures it is firmly attached to sutural membrane. Superficial temporal region. It is the area between the superior temporal line and the zygomatic arch. This area contains the following 6 layers: skin, superficial fascia, thin extension of epicranial aponeurosis, temporal fascia, temporalis muscle, and pericranium. Graying of hair first starts here. Arterial supply. In front of the auricle, the scalp is supplied by supratrochlear, supraorbital, and superficial temporal arteries. The first 2 are branches of the ophthalmic artery, which in turn is a branch of the internal carotid artery. The superficial temporal artery is a branch of external carotid artery. Behind the auricle, the scalp is supplied by posterior auricular and occipital arteries. Both are branches of the external carotid artery. Venous drainage. The veins of the scalp accompany the arteries and have similar names. The supratrochlear and supraorbital veins unite at the medial angle of the eye, forming the angular vein, which continues down as the facial vein. The superficial temporal vein descends in front of tragus, and joins the maxillary vein to form the retromandibular vein. This vein divides into 2 divisions. Anterior division unites with the facial vein to form the common facial vein, which drains into internal jugular vein. Posterior division unites with the posterior auricular vein to form the external jugular vein, which ultimately drains into subclavian vein. The occipital veins terminate in the suboccipital venous plexus. Emissary veins connect the extracranial veins with the intracranial venous sinuses, to equalize the pressure. Lymphatic drainage. The anterior part of scalp drains into preauricular or parotid lymph nodes. The posterior part of the scalp drains into posterior auricular or mastoid and occipital lymph nodes. Supply. Scalp and temple are supplied by 10 nerves on each side. Out of these, 5 nerves, 4 sensory and 1 motor enter the scalp in front of the auricle. The remaining 5 nerves, 4 sensory and 1 motor enter the scalp behind the auricle.
Thank you for watching. Don't forget to subscribe, like, share, and comment down.